my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. And in this video, we're going to be talking about how we figure out if keyhole surgery is really going to be the right procedure for you. And so, first of all, as most people know, there's two main ways of doing gender affirmation top surgery for folks who are assigned female at birth. And so by far the most common way that's done in the United States is double incision with or without free nipple graft, depending on the patient's needs. And so the downside of that surgery is obviously we have a scar, and so folks with a smaller chest who want to avoid the scar will opt for keyhole surgery. And with keyhole surgery, what we're doing is just creating a little scar that's hidden in the areola of the nipple. We're sneaking in, we're removing the tissue, but because we're not leaving it a larger scar, we have no way to shrink down the skin that's there. So it's only folks who are typically about an A cup who are able to do the keyhole procedure. However, there's a couple of other things that are super important to know when we're trying to decide which is going to be the best procedure for you. So, even though the amount of tissue on the chest is very important, the shape of the chest is also pretty important to figure out if keyhole is right for you. And so typically, if a patient has a lot of projection or the breasts stick out a lot, they're usually not going to be a good candidate for keyhole, because if you think about it, when we sneak in and remove the tissue, oftentimes the whole breast or the skin can kind of collapse and the nipples end up looking at the ground, and typically they're not going to shrink back in. So usually a good candidate for the keyhole procedure is somebody with a flatter chest to begin with, so it doesn't project out more. So that would be one reason we're not able to do keyhole. Another reason is if the patient has a large areola. The areola of the nipple is a large diameter. Typically, their results aren't going to look so good because the areola is still going to be the same size. Now, this is a little bit confusing because some people do what's called a periareolar incision, where you cut around and try to reduce down the size of the nipple. I don't do this in my practice because the chest is one of the least forgiving parts of the body when it comes to scarring. And what I've seen and had to do a number of corrections on and patients who had their surgery done elsewhere and had that technique is sometimes you can get a very widened scar around that nipple. We actually have a term for it. It's called a starburst scar or starburst nipple. And the problem with that is the nipple can look very large even though we're trying to reduce it. So for that reason, I don't offer peri as part of my practice. And so if your areola are too big to begin with, I usually recommend that folks go for double incision instead. Now, even if you're in this boat and you don't have much scar tissue there, it's still very possible to get a beautiful result. Or if you're in this boat and you don't have a lot of breast tissue there, it's still very possible to get a very good result, because typically in that sort of patient, we can park the incisions right underneath where the pec muscles are and teach you all the best ways to take care of the scarring. But even if you don't get great scarring, the incisions will be right underneath where the pec muscles are and tend to look very natural. And so in these patients, I always steer them towards the double incision with the free nipple graft, because that in the long run is going to give them a much better result. And if we do keyhole in somebody who's not a candidate for it, well, we're just buying another surgery in the future. So it's better just to do the right procedure first time round.